Firstly, news that you do not understand. This, for instance, is where you've come into the surgery to have some blood tests done. Perhaps it's something like checking the salts in your blood. You have a blood test in the morning. That blood test is then sent off to the hospital to be processed, and then the bloods go to the pathology lab. The tests are done. Once the results have come back, they come back electronically back from the lab and drop back into your medical record later that evening. Let's suppose 10 o'clock at night, having been out and about all day, you decide to log onto your medical record, and you notice that the blood results have come back. And you find that when the results have come back, there's an exclamation mark next to one of them, and it's saying abnormal. Let's suppose, for instance, it's something like your urea, and your urea is 7 or 8 when it should be less than 5, and your creatinine is 89, which is normal. What are you going to do? What are you going to do when you look at that exclamation mark next to your urea and a word next to it saying that that's an abnormal result, or it's not a correct result? Well, you may do nothing, or you might get quite anxious. What are you going to do then? What should your partner do if you're troubled by that result? Let's suppose it was a Friday night and the surgery's not going to open till Monday. Are you going to be able to wait till Monday? If you couldn't wait till Monday, where would you go? Well, some of the options that you have are, you could go to a website that gives you more information about blood results, what's normal and what's abnormal, and in your support pack you'll see a website like that, labtests.org.uk. Alternatively, you may feel that I don't want to see a website, I'd actually like to talk to somebody. And of course there is NHS Direct, so you could ring NHS Direct on 08454647. It's a service that's available 24 hours a day, 7 days a week, and you can talk to a trained professional nurse. But remember, the nurses may not be aware of this Records Access initiative because it's so new. Nonetheless, they'd be able to advise you on whether you need to do something about it or whether it can wait till the next day when the surgery is open. Alternatively, you could ring through to the surgery, and the surgery will put you through to the out-of-hours service, and there's always a doctor or nurse available that you can speak to, and if need be, they'll even be able to see you and advise accordingly about the results. Finally, if you're very distressed and you really can't wait for anything, you could go to casualty, but of course we only recommend that as a last resort because casualty tends to be very, very busy with very ill people. So that's news that you don't understand. Just to go over it again, you can either wait for the practice and then get back in touch with the practice to see what you should do about the abnormal result. Secondly, you could ring up NHS Direct and ask for their advice, or you could ring the out-of-hours service, or you could go to a website that gives you more information about the condition or the test results, or if you were really desperate and couldn't wait for any of those things, then you might be able to go to casualty.